Hi, welcome to Avid Sports Medicine. We are going to go over our youth injury prevention and recovery series. Today we're going to be focusing on the lower body and specifically in a hip position that is going to address both rotation of external use and internal use. Okay, so we're going to do both. So how the hip rotates is going to be very key to how you move when you're out on the field or on the court. Okay, so we're going to start in this hip 90-90 position. So 90 degrees at both knees, the rear leg and the forward leg. Okay, now some of you being in this position may find it hard to stay upright. You may have to kind of lean off to the side if you have a little bit more hip tightness in that forward hip. So here Liz is able to sit upright, which is great. And then what we're going to do is keep our chest nice and proud, and we're going to hinge at the hip moving forward. So why we're doing this is we're increasing the attention to the forward hip. In her case, it's her left side, and she's focusing on staying in this position for over or up to 2 minutes, okay, depending on how that feels to you. If it's too intense, you may want to go a little less further towards the ground. You may want to bring your chest up and hold that position. Wherever you feel a good amount of stretch is where you want to stay until you can relax into that deeper position. So if you're finding this difficult, this is something that you probably need to address. If you feel any tension in terms of like causing tingling or numbness down the leg, that's telling you you're going too far and we need to relax a little bit. So we're going to hang out here, and for time's sake, we're going to pretend like we did 2 minutes, and then after that 2 minutes, we're going to actually raise up just a tad so that we're on our hands. So we're going to hold this position, and then what we're going to do is we're going to try to keep everything nice and tight through our upper body and our abs, and then we're going to take this rear leg, okay, and keeping that forward leg where it's at, we're going to now rotate this rear leg, and you can see that her knee stays down while her foot comes up towards the ceiling. And she's going to pause and hold. Now some of you, when you first do this, you may not know how to lift that leg, or it may not even clear the ground. It may not come off the ground, and that's okay. But what we're trying to do is get this hip now, this trail leg hip, to rotate. Her pelvis comes forward. She starts to rotate this bone, this long bone called the femur, and she's holding tension in her rotators here to hold her leg up, and then she's going to come back down. Now as you're doing this, you're pausing for 5 seconds, trying to hold that. While you're doing that, you're going to feel a deeper stretch on that forward side. So again, 2 minute hold, and then for a minute we're going to lift this and hold it there for 5, and then we're going to come back down. Now you can do this for the beginning of your workouts. You can also use it at the end of your workouts, which is a great test to see if you've able to retain the motion that you had prior to going into sport or activity, or if you have more tension, that might be something you need to address at the end. So I'd like you to do 2 minutes per side with another minute added on to add those rotations to the rear leg.